Good afternoon, good evening, good morning. My name is Danny Harris. I'm honored to be the Executive Director of Transportation Alternatives, and just so grateful for all of you for joining us over these last 2 days for just an incredible conversation focused on both designing and advocating for better, safer streets that are not just sort of better for us to get around, but better for the environment, better for low income and communities of color, better for our communities to thrive, and especially as we look at COVID, really thinking of streets as a pathway for recovery. All these things are obviously incredibly important, especially as we're seeing an uptick of traffic violence, not just in New York City, but as hopefully you saw the tragic numbers that came out of NSC yesterday, but obviously seeing a growth in traffic violence across our cities, even as driving goes down. So this work is incredibly important. And thank all of you for not just joining us, but for doing the work every day. We're, again, so grateful for your partnership. Today, I have the opportunity to share with you a big initiative that Transportation Alternatives and now more than 110 coalition partners just launched this past Monday, which we call 25 by 25. And quite simply, we are demanding that those who are stepping into office will think of streets differently, and that we put forward a challenge to our next mayor and our next council that they would repurpose 25% of our street space by 2025. So again, here I'm putting my email at the bottom. You'll have it again at the end. But we put together some videos, and I hope you'll also have a chance to take a look at our website and see how it's all put together at nyc25x25.org. Just a little bit of background about Transportation Alternatives. So we've been around for almost 50 years and really just been on the forefront of helping the city to reimagine our streets. So not only are we sort of thinking about things like busways and obviously bus and bike infrastructure, we're just looking at the fundamental inequity of our spatial allocation, where right now more than 75% of our street space is devoted to the movement and storage of vehicles. So in addition to supporting everything from Vision Zero to City Bike to the transformation of Times Square, we're obviously looking at things like 14th Street, which is the first dedicated busway in New York City and has been transformational in terms of shifting not just how people move, but also how we think about space. So I'm incredibly proud to have led this organization now for 1.5 years with an incredible team, many of whom you've met and have heard from, and just am so incredibly grateful for the work that we'll do moving forward. So right now in New York City, and again, we're sort of centering this in New York, but the reality is that these numbers are not unique to New York City, and I would imagine that they're going to be higher in even many of your cities in terms of what spatial allocation looks like. Right now in New York City, where the minority of households own a car, which is an important premise here also because we have a great public transportation system, is that our city currently devotes 19,000 lane miles for driving and 3 million free parking spaces. So while sort of the typical thought in New York, for those who do have a car or those who have driven, is there's not enough space for cars and there's certainly not enough space to park. The reality is that there's 1.5 parking spaces for every car in New York City. Just in contrast, there are for every 116 bicycles in New York City, there is only 1 dedicated parking space, just as a reference to share with you. So when we look at what the total breakdown looks like across New York, just to sort of break down what that 75% is, half of our right-of-way is devoted to moving vehicles. About a quarter is devoted to, again, parking, again, with the vast majority of this being free parking. And then the rounding error goes to things like protected bus lanes and bike lanes. And then obviously sidewalks do represent a significant piece, although I do want to get into that in a second because we have no shortage of blockages or even small sidewalks across New York City. So now as we think about in New York, we are in the middle of, or we're sort of early on in a mayoral race. We'll have a new mayor next year. And obviously seeing amid the incredible challenges of COVID, which remain, the way that streets have stepped up to be a pathway to recovery. And so New York City has had more than 80 miles of open streets. We have more than 15,000 restaurants that have taken advantage of our open restaurants program. We have now Open Culture, which are programs to bring more to arts and culture into street space, schools, retail. So many New Yorkers are starting to think differently about streets and helping them to support their needs, whether it's public space or need for social distancing or the ability for our economy to continue to thrive. So now at this critical moment, as we think about the future of our city, we need to address this inequity on our streets and think about fundamentally how our streets can serve all New Yorkers, especially our most vulnerable, low-income communities of color, those with limited abilities, seniors, children. It's time to start building our city for them. And also, as we talk about, this question of budgets, and New York is not unique. I'm sure all of you are facing this as well when you go in and talk to your counterparts there, talking about decreasing budgets. It's fundamental that we also start with what are the costs associated with our current sense of normal on our streets. So we know that in New York City alone, that congested street is costing almost $2 billion just in travel time, in addition to lost productivity. We know that the cost of traffic violence costs the New York City economy an estimated $4 billion a year. And this does not also touch, the fact that, communities, especially communities of color, are trapped in asthma alleys and asthma triangles, the intersection of poor air quality and COVID, what it means for healthcare workers to have the longest commute time. All of these things have fundamental costs. The negative externalities go to almost every section of the city. And even when we think about projecting out into the future, we obviously know that greenhouse gases are, transportation is the second leading cause of greenhouse gases in this city, and I'm sure in yours as well. So we fundamentally need to reimagine our streets, because if not, we cannot afford a future that continues to be built around cars. So our challenge is a pretty simple one. I think for those of you who have been doing this work for some time, or have obviously seen the incredible transformation we've seen in cities around the world, our premise is a simple one, which is that we need our next leaders to give our streets back to people. Again, it's a very simple idea. It's complicated to bring about, but just to sort of share with you how we have structured this campaign and how we see the opportunity. We wanted to build this campaign that was rooted in research, rooted in community partnership, and rooted in a very dedicated and firm set of next steps. So we're incredibly grateful that now we have a coalition of more than 110 partners across every borough of the city. They represent everything from unions to community organizations, businesses, organizations that work on everything from racial justice, environmental justice, those who are thinking about public space, those who work with children, those who work with older people. This is not just focused on bus and bikes. I think as we all have sort of seen in the transportation space, we're now approaching a broader tent moment where we need to be thinking again about streets as an asset that serve more people. And for those of us in the past who've solely been focused on bikes or buses, those are incredible important pieces. But when we're able to sort of elevate what the opportunity looks like, then we can bring so many more people in who may ride a bike or ride a bus, but they may not necessarily primarily associate themselves with that. But now we're talking about broader issues that really connect with all New Yorkers. We've been incredibly grateful that since Monday, we've had 5 mayoral candidates who have responded positively to the pledge that we've put forward, almost all of them within the first 24 hours, including one within about 3 hours. We've had more than 12 city council members those who are running for city council or for borough president, who have also responded positively to the pledge. And most excitingly, too, for all of you, especially those who are outside of New York, is we've had cities around the country who find ways of either adopting the pledges or putting forward a challenge to their candidates of what they will do. We've seen everything from what's happening in St. Louis to LA to Seattle. So really excited, and would encourage you to adopt this pledge on your own and figure out how you can use this as a prompt to push your elected leaders as well. So when we think specifically about what this could look like, I think over the course of the last 2 days, we were really talking about some transformational ideas that can be done quickly and obviously over some more time, but what could this look like at scale? And so what we've done is we've hypothesized if we were to take 25% of New York City's current street space, which is the rough equivalent of 13 central parks, of what could be done with that. And this is not prescriptive. This is just a set of things that New Yorkers could have. So I'll just sort of share a few of these. So, we could have 500 lane miles of protected bike lanes, really building a connected network that unites our city. We could have dedicated busways. These are 40 miles of car-free busways. We could have sort of new and dedicated bus infrastructure. And I start with these because it's critically important. And the way that we thought about the report was, how do we center giving New Yorkers immediate transportation options to get around? we're not taking away options from New Yorkers, but we're immediately thinking about how this space can serve the New Yorkers, especially those who need them the most, and provide real options for New Yorkers to get around tomorrow. As we've seen, and I'm sure you're seeing in your cities or elsewhere, these things are able to happen quickly, despite what we hear from DOTs. What we've seen from New York City to London is that these projects can be rolled out, maybe not overnight, but much faster than the process that we've seen to date. So we need to build these out quickly and ensure that New Yorkers have safe, equitable, accessible, and safe options of getting around quickly, especially as we do start to transform our street space. We could have 1,000 miles of permanent open streets. We've seen the incredible success of what that means here, especially about how that can empower community voices. Universal daylighting at every one of New York City's intersections, which also means that that dedicated space can be things like bioswales or street trees or benches or street parking, or bike parking, but sort of amenities that serve what's needed by the community. We can obviously have space for for open restaurants and open culture, more community groups that need access to the space. We have 5.4 million square feet. I want to focus here on sort of a few interesting ones as well, which is we want to create dedicated space outside of every school in New York, which would be almost a permanent open street. You could still obviously have drop off for people who need to bring their kids there, but this would be dedicated space that would help incentivize and encourage more kids to walk and bike to school and create safe spaces right in front of schools, which we want the schools to be able to spill out onto the street. New York City has a huge trash problem. Our trash just fills up. We have these mountains of growing trash on our sidewalks. We want to create dedicated space on every curb in New York City, on every block in New York City, where you can have dedicated space for garbage, so it can be moved off of the sidewalk, creating more space for people to get around, especially those who may have ambulatory challenges, older New Yorkers, those who have strollers, as our family does, to get around. And also thinking about how our subway stations can expand out in and around the street, that these can really be commercial connection hubs, where it's not just a subway station, but it now can be better integrated with bike share, with street vendors outside, having more public space, really thinking of these as kind of little community hubs all across the city at all the places where we do have subway stops. So this is big transformational ideas that can serve every corner of New York City. And again, these are not prescriptive. We're not saying that this has to happen, and we're not saying that one neighborhood, everything has to play out in the same neighborhood. We recognize in New York that a place like the Financial District may require more than 25% of street space to truly be the place that it can be. And other neighborhoods that may be more suburban would be less than 25%. So again, this is just sort of a suite of options that we're incredibly excited to share. We also, in our report, we talk about a diverse set of archetypes who would benefit from this. So right now, and I just want to sort of start with lower income New Yorkers who have to get around. Healthcare workers in New York City have had, before COVID, and certainly even worse now, have had the longest commutes in New York City. This was obviously tragic before COVID. It is even more so now. If we're able to provide safer access for people to get around, easier commute times, and even the option that biking could be an option for people to get around, especially from the outer boroughs, and whether it's with dedicated bikeways and bike highways, or pedal assist, or now e-bikes, now that they're legalized in New York, this could change the landscape for so many New Yorkers, especially low-income New Yorkers. We know, according to the work from Raj Chetty, that commute time is one of the single biggest indicators of moving people out of generational poverty. We can have the bus now be a safe, equitable, and fast experience, just as we've seen on 14th Street with the transformation of one of the slowest buses in New York to one of the fastest. So this can really change the equation for New Yorkers, especially low-income commuters who have to get around for work. Just sort of, again, prioritizing the movement of things like buses and bikes. For New Yorkers who are living with disabilities, about 10% of New Yorkers have a disability, and I believe 1 in 10 of those have ambulatory challenges. So what we're looking at, quite simply, is how we can make the city better for all of those to get around. And again, prioritizing our most vulnerable. When we look at things like Access-a-Ride, which is a tool that individuals can use to access public transit, or in the absence thereof, they can use it as a tool of public transit. We can use our curbs more effectively, both in terms of taking trash off of the sidewalk, but creating dedicated spaces on curbs where individuals who have disabilities, especially ambulatory ones, can have easier access to get to paratransit in order to get around. We can have, we can have curb cuts. We can have wider sidewalks. We can create the type of infrastructure that really works for all New Yorkers. And I think a fundamental part of this is that we are fully aware that these challenges need to engage with all communities, and especially the disability community, to understand how these changes can be communicated in a way where individuals know how their infrastructure is changing, especially those who might have vision issues, or those who may have vision impairments. So quite simply, we understand that these challenges need to happen in a way that transform the city and are communicated in a thoughtful way across communities, especially those who would be most impacted by them. When we're looking at health-related challenges, and especially if you're looking at high levels of asthma rates or heart disease, which are one of the leading causes, at least asthma, especially among children, and especially in places like the Bronx, which has the worst health outcomes. I mean, these are directly tied to what's happening in the air. And obviously, as we have more of in New York, the Robert Moses infrastructure that continues to cut through communities and pollute our environment, this is having real implications on individuals who are having shorter lifespans, also for children who are having increasingly amounts of asthma, and also just for the ability of the strain of what that means for your ability to get out and take a walk, or to be with your kids or grandkids, and to do so in an ongoing healthy manner. When we were looking at the data, around roughly if you spend about $1,300 a year on per individual on infrastructure, it can increase lifespan by upwards of a year. So these ideas that we're talking about are fundamental. They're also really good for health. So, when we were building out this plan, a lot of what we were hearing back was, well, what is this going to mean for drivers, and what is it going to mean for cars? I think we've all kind of heard this in our work. But what we found is that when we look at the research, and as obviously many of you know about induced demand, is that when we do create the type of infrastructure that prevents more options and doesn't widen, but actually may reduce some lane width, it actually can reduce the amount of people who do drive. And I think that we need to recognize that in order for plans like this to be effective, we should recognize and sort of honor those who still need to drive and provide a better experience for them. I mean, look, drivers aren't winning when they're stuck in traffic all day and they have road rage, and they also are, sort of inhaling the fumes of exhaust. If we're able to create a better situation where people who walk thrive, and people who ride a bike, and people who ride a bus, and people who ride a subway, and those who drive, where everybody's doing better off, as we've seen in places like Times Square, then everybody wins. And it also encourages sort of more opportunities for people who may have cars to opt into other options. And for those who really do need to drive to get around, whether they're essential workers, or whether they're using emergency vehicles, or whether they're just passing in to experience New York, or to come in for the day, we should hopefully all have a better experience because of this. So while we were building this out, we realized that it's obviously big, ambitious policy, but it's also grounded in really good politics. So we worked with Siena College before this came out to do polling across New York City voters to understand a number of issues. And one of the things that we asked about was specifically to the 25 by 25 report, is whether people would support a variety of amenities, from safer crosswalks to more protected bike and bus infrastructure, to street trees, to more places for children to play in their neighborhood, even if it meant fewer spaces for cars. And we added those last two pieces because it's incredibly important that we don't just sort of talk about how people feel about these issues, but specifically what it would look like on their block, even if it meant removing spaces for cars. We found overwhelming support across New Yorkers. We just share here some of our statistics, but I would encourage you to take a look into our report, where you'll be able to see that the numbers play out across the city, across the boroughs, across demographics, across age, across household income, even across car ownership. What New Yorkers are saying, in some cases they're screaming, is that New York voters want amenities in their neighborhood that serve a higher purpose than simply the movement and storage of vehicles. And on the other side of this, we also asked New York voters whether they had been impacted or injured in a crash or accident. We use both words because obviously we use crash, but some people may be more familiar with accident. And we found that 30% of New York voters had been injured in a crash, and 70% of New York voters know someone injured or killed in a crash. These numbers are astonishing. These numbers are higher if you are Black, if you are over 50, if you are in a household that has an income under $50,000. And if you are a resident of Staten Island, 48% of Staten Island residents have been injured in a crash, and more than 88% of Staten Island residents know somebody killed or injured. I mean, these numbers are terrible, they're unconscionable, and these are all, again, based on things that we know are solvable. So, you know, as we sort of think about the future of this city, and I would say all cities, you know, again, we can't go back to normal, and we have to think about these overlapping crises of racial injustice, of COVID, of climate change, of budget crises, you know, and the list can go on. And quite simply, we've made the ask for New York City leaders to do something relatively simple, which is to put people in front of cars. And we're not asking for all of road space. We're not even asking for a majority of the road space. You know, we went in with a request to ask for 25% of our road space to be transformed by 2025. We realize it's bold and it's ambitious, and at the same time, we believe that it's achievable, especially when we look at the incredible work that's been done around the world, and we look especially to, we've had a lot of conversation about what London and Paris have been doing over the course of this. So I guess quite simply, you know, our takeaway, and I'm sure as all of you know, is that, you know, our streets can do, and most importantly, they can serve more. You know, we sort of close, I would like to close with a, you know, as we were building this out and having a lot of conversations, we were really fortunate to engage with more than 200 individuals and community partners across the city in developing our New York City 25 by 25 campaign. You know, one constant remained, which is, you know, neighborhoods that have been left behind and continue to be left behind because of racism in planning, because of communities that are in transit deserts, because these are communities that are physically choking because of car exhaust. You know, this is not a normal that we can return to. And even if we just start with this, even if we just sort of look at communities that are reliant on cars, you know, these are communities where individuals may have to be spending upwards of $10,000 a year on car-related payments. You know, in that case, advocates haven't failed you. The city has failed you. The car companies have failed you. The oil companies have failed you. Those who continue to want to fight against these alternatives that put people first, you know, are not fighting for the benefit of New Yorkers. They're fighting on the benefit of interests. And so we're incredibly grateful to be working with such a large coalition. We urge all of you who might be in New York to come join us at 25 by 25. You can go to our website and add your name. If you're on social media, please tweet about it, hashtag NYC25X25. Please check out our video, read the report. We hope that the report will be chock full of a lot of information that can be helpful for you in whatever city you're at. And just, again, a huge amount of gratitude for all of your support along the way. And with that, I will turn to some questions that are coming in. If you have any, please put them in the Q&A. Actually, it seems like that might be it. Okay. Well, thank you all for joining. I feel like I'm sorry we're a bit over time, but thank you again for being with us, and we'll look forward to seeing you soon. Be well. Bye, everybody.